What is opioid replacement therapy? Another name for this would be opioid agonist therapy, many other terms for this. But what this implies is one of two drugs, either methadone, which is the older one, and the newer one called Suboxone. The proper name is buprenorphine. The idea is for somebody who has tried to abstain from opioids but has failed in the past, and they have continued relapses and it's just not working for them. So instead of going completely drug-free, the idea is to put them on the opioid replacement therapy, which stems the withdrawal syndrome. It gets rid of the withdrawal syndrome, yet at the same time does not make them high. So this allows them to function and to return to their job, return to school in a functional capacity. These medications are prescribed by a medical doctor, and the idea is to wean off of these in due time. Some people have a rapid wean, which is a little harder and there's more likelihood of failure, versus a slow wean. So this is generally 10% per week or less of the dose that's given, and they take less and less of the opioid replacement therapy. Sometimes they can wean completely off, but that sometimes is difficult. Most of the time it's difficult. And so people stay on this long term, and there's nothing wrong with that, because that's much better option than being a slave to the drug, when they're actively seeking their heroin or OxyContin or whatever the drug of choice is. So to summarize, opioid replacement therapy is an excellent alternative to total abstinence. What this is saying is that instead of going cold turkey or stopping the drug of choice, is to switch over to a bridging therapy, whether it's methadone, which is a liquid, or Suboxone, which is a pill. And it allows the person to start functioning, to not go through withdrawals anymore, and they can settle back into their normal life routines. The final part is to try to wean them slowly off of them so they're not on high doses for the rest of their life. Ideally to get them off it completely, but some people have a hard time with the final 10% or so. And if that happens, then there's nothing wrong with this person staying on it for their lifetime.
If you or a loved one are looking for help with substance abuse, call our 24/7 helpline at 1-800-615-1067. A caring addiction advisor is awaiting your call.